As the vetting of the various cabinet nominees continues, we promised that we'll be giving you an in-depth and objective analysis, and we are working back to back to bring you a balanced third eye analysis of the same. Welcome to the Bold Analysis. My name is Frank. I've watched closely and keenly the vetting session of Dr. Debra Mulongo, who has appeared before the vetting committee today as a cabinet nominee for the slot of the cabinet secretary in charge of health of this country. This is a position that was previously held by Susan Nakhumicha, who took over from Mutahi Kagwe. And this is one of the critical ministries in this country. I think that might have informed the decision to have the nominees among the first one to be interviewed or vetted just before the cabinet secretary, just after rather, the cabinet secretary in charge of the Interior and National Coordination of Government Affairs. Why am I saying that this has been, or this is one of the critical ministries in this country? Health is one of the basic needs of a country, just the same way as shelter and food is. And I think that could have informed the decision also as to why the next nominee that is going to be vetted is the CS for lands. And when we talk about health in this country, health is critical because this is where a basic structure or a basic unit like the Afya House is where most of the corrupt dealings in this country always emanate from. You remember the cases of the likes of KEMSA, name them. Some people even went ahead to rename the Afya House as Mafia House. And in that vetting today rather, I've been closely looking at the nominee for the cabinet secretary slot of health. And at a first look, Dr. Debra Mulongo appeared as somebody who is young and experienced, even though she exceeded some level of fear, according just to observatory, but that one is normal. Somebody can have that anxiety because maybe it's her first time appearing probably for a very senior position in this country, like a position of the cabinet secretary in charge of health. But I've been closely looking into all those because I've been asking this because this has been one of the controversial, as I've told you, and corruption-ridden ministries in this country. And maybe in summary, I can say that Dr. Debra tried in that interview or in that vetting, though she failed at some points to give most satisfactory answers on some critical issues that are bewildering this Ministry of Health. Key among them was on how she failed to give a satisfactory answer on how she plans to deal with the cartels at the Mafia House, or rather at the Afya House. People tend to come and go in this Ministry of Health. And remember, just some few or less than 4 months, a permanent secretary in the Ministry of Health, when this government assumed office in 2022, was sent home just over the same corruption scandals with less than 4 months into office over the mosquito net scandal. I just want you to have a snippet of the interview for the nominee for health, the position slot of health ministry. That is Dr. Debra Mulongo, who is the incoming CS nominee.
Do you have what it takes to fight the corruption cartels in Afya House, in NHIF, in KEMSA? Do you have what it takes?
Go ahead and answer.
Mr. Speaker.
Yes.
I think we also need to be fair to our time and the nominee. That question has been asked several times, so we can't keep on repeating the same. So I think honorable members must be attentive.
Speaker.
Yes.
Speaker.
Yes.
The question of the mafias and corruption was asked, but I think to be fair to the majority leader, he's asked about what he thinks in terms of demeanor. I think it is just more in her direct strategy. And even as you respond to that, I would tell you that the mafias always also say, we have seen many come and go, including the most recent one. So I think as much as that question has been asked, she can respond to it.
Isula is taking over my job.
Women power.
Let's take Razon.
Is the taxation of 2.75. We are not talking about accessible, affordable quality of care for all Kenyans, including the vulnerable and the ones with disability. So there's need for robust communication. We need to strengthen communication to the community so that they embrace and they own this initiative. We need to gather feedback and see how we can address the challenges. We need to look at the misinformation and counter it. We need to engage the community. And one of the people in the community that we can use are the community health promoters. And so I think that, or I believe that the risk communication, community engagement, addressing all these things is really a critical highlight before embarking on this journey. Regarding being able to manage the mafias.
You can't manage them, you confront them. That is what you have been asked. You eliminate them.
So, Honorable Chair.
Your colleague who came earlier said you neutralize them.
First of all, we can look at prevention than treatment. And one of the areas is the early warning indicators. We can use a digital platform, yeah? We can use, open tenders or transparent tenders. And we can use independent bodies to monitor this. And engaging the EACC and other bodies in this.
Go ahead.
In the discussion. So I think we need to strengthen.
You have the courage and the will. That is the question.
But at the helm, while at the helm of the ministry, Nakhumicha had very many shortcomings or challenges that she faced or had in managing this ministry. And these are the things that, despite her few achievements, Dr. Debra, or the new nominee, or the incoming CS nominee, has and will be a daunting task ahead for her, and will be a good test trial for her, that if she's not careful, she's also likely to lead the path of Nakhumicha, especially at a time that she's coming as a professional with a background in issues and matters to do with health. Of course, she has been at very many bodies, including the World Health Organization. Maybe she can use that to her experience. But let us now just look at some of the challenges as well as shortcomings that Nakhumicha had that she has to be very much wary of. That I think, if you are concerned, maybe as a view of this, about the health of this nation, you'd find very much interesting. One, Nakhumicha failed to incorporate county governments and other key stakeholders in most decisions that she took, and especially also in bills that she presented before Parliament in regards to the management and running of the Ministry of Health. There, she failed. Therefore, here the new nominee must walk into this wary of the same, that public participation inclusion of all sectoral stakeholders is very key to achieving the universal health coverage in this country. For instance, the issue of addressing the universal health coverage, at some point I felt Nakhumicha was going at a speed. She was rushing. For example, take for instance the implementation of policies such as the Social Health Insurance Fund, the SHIF, and the transition from the NHIF. Those were cases in point where there was rush without due consideration and due deliberation. I saw the other day the court gave suspension orders into the implementation of the Social Health Authority over what the court termed as not incorporating the public opinions. And these ones, if we are not careful of, or if a review is not taken on the same, then we are likely to encounter problems going forward in terms of some of the policies or directional policies that were taken into this. So this is an area that needs a review. You saw the issues surrounding various critical programs such as the Linda Mama initiative. We had the Beyond Zero, of course, was a product of the First Lady, the then First Lady Margaret Kenyatta. But the Linda Mama thing was very critical, especially in terms of combating the maternal deaths that we do witness in this country. It came as a savior, and therefore throwing it under the bus meant or would mean that many mothers would be staring at an oblivion. What will be the future? Especially at a time when the economy is really hard for many people maybe to afford decent health care. If the healthcare system is not a universal one that can afford to be affordable and cheap to all. The other thing, or the other factor that she needs to be wary of, is that the health sector is a very wide sector with various departments that would make it a nightmare for her to deal with if she's not careful. Talk of the doctors' unions. We have the KMPDU. Talk of the nurses' unions here. Talk of the procurement issues within the Ministry of Health. Talk of the system of cartels and mafias within the Ministry of Health. Talk of very many parastatals within the Ministry of Health that are often corruption mad. The issue, for example, of a doctors' union, we've seen a case where the KMPDU goes to strike or goes for industrial action. Then, some days after they've settled their issues, the clinical officers' unions also go into the industrial actions, or maybe the nurses' unions go for industrial actions, therefore paralyzing the health sector in this country. Many people are left wondering of where, because this one basically comes in where you walk into a health facility, you find that maybe this health facility only has an access to one doctor or maybe 3 clinical officers, and the rest are maybe nurses or trainees. So these are issues, or the others are community health practitioners. These are issues that needs to be looked into very keenly and under good lenses in order not to cripple the health sector in this country. These are issues that have bewildered many, and as citizens get to be affected over the same. The other issue that she needs to look into, I also had her talk on the same, but needs not just a talk, but an action-based plan, is the idea of having the health, I think it should be the Health Service Commission. Some people term it at the need for a National Health Service Commission to be in charge of very many issues. Key among them is the issue of the human resources. The human resource, or resource rather, human as a resource rather, within the Ministry of Health. Because that has been the poison here. That has been the reason as to why doctors go on strike. That has been the reason as to why intern doctors go on strike. That has been the reason as to why nurses frequently go on strike. That has been the reason as to why the clinical officers frequently go on strike. And the health sector has been witnessing a paralysis where many people have been losing their lives when especially doctors are on strike or any other health workers are on strike. You know, Nakhumicha tried to address this with coming up with the Kenya Health Advisory Council, which to date has not achieved maybe some of the intended objectives that was to be achieved, with the same key among them addressing the issue of the human resource. Key among them, the numerous strikes that we've been witnessing, failure to implement the collective bargaining agreements, especially the one that has been thrown in the recent past, has been the Kenya Medical Practitioners and Dentists Union 2017 CBA. That was to address key issues, among them the issue of how to appraise the intern doctors in this country. And this one has seen a case in point where we've been having a brain drain, where we've been losing our human resource capital to other countries. We train doctors with the taxes of this country, then only for these doctors to migrate into other countries because of no favorable work conditions or payment conditions in this country. So these are issues that need a critical and careful consideration and relook into the same, so as to lift to the next level the level of our health service structure or system in this country. Then the other thing or the other issue that the new health cabinet secretary needs to be very much wary of is the issue of the politics at the Ministry of Health. Politics are very much invested there, especially the politics of procurement, the politics of tenders, and the politics of the human resource. Tenders especially is a very hot issue. Especially we've been witnessing this in bodies or parastatals such as the Kenya Medical Supplies Authority, KEMSA, where many CEOs have been going home over corruption scandals. Many workers who worked here are still having cases that are pending in court over corruption-related issues. And still under the politics at the Ministry of Health, she needs to strike a balance between the technical part of running this ministry and the politics that are at play in these ministries. I saw many members of this vetting committee ask her questions specifically on this, up to a point that the speaker told them that we've been dwelling on this single issue of the mafias or cartels for so long. And indeed, it is an issue that is really bewildering the health service in this country. The other issue that she needs to look at with a lot of concern is on the need. You know, our health service system seems to be more of a donor-funded system, especially on vaccines and drugs, as opposed to the government funding. We depend on a lot of donor fundings to run most of the programs in the Ministry of Health, as opposed to the amount that we should be dependent on the ones that the government gives. Why do we need to be careful on this? We've been having, you know, we have a foreign policy that is in our country, but then the level of our foreign or diplomatic engagements in the recent past has been quite shaky. You've seen the president move around the countries or around the world trying to secure diplomatic relations with other countries. So it means that we've not been having a solid one. So in the event that we are not having a solid one, and the level of global insecurity or security challenge situation that is there, what of in a situation that we have failed diplomatic relations with a given state, whom maybe, for example, we so much depend on for donor funding? What will be the state of our health sector in this country? Because this one also has effects such as the recent vaccine shortages that we've been witnessing in the recent past in this country, we've also had reports of how HIV and AIDS infected persons or people living with the same have been on a fear or have been fearing to fail to get drugs, because some, in instances like this, we depend on drugs that are from donors in order to run such critical programs and campaigns. This also comes at a time when most of the funds from the budgetary allocations from the national budget remain with the national government, when most of the workload in terms of a delivery is within or is a devolved service or unit within the counties. So that is a place where they need a good discussion with the Council of Governors and especially the Committee on Health within the County of Governors to strike a working balance that will boost the level of health service delivery in this country. Of course, this also comes at a time when there is a debate as to whether there is a need to revert health services to the national government and not to the counties. I know that is an area that requires maybe an issue like a referendum. I think it was either in one of the proposals that the BBI report had. So that is critically also an important area that she really needs to have a look into, or the Ministry of Health needs to have a look into in terms of their policy direction. One thing that I'm glad of is that she highlighted the issue of incorporating the Linda Mama program into the blurry social health insurance fund. Why do I call it the blurry? This is something that just walk out here and ask any citizen how much informed they are about the social health insurance fund. That public information out there, people are not well versed with it, even at a time that it has started already accepting registration for membership and phasing out the national health insurance fund that was equally corruption mad. You ask somebody to differentiate for you the difference between SHA, that is the Social Health Authority, and its relation in regards to the Social Health Insurance Fund, I'm quite sure that there is a lot of problem in differentiating the two, or differentiating the Social Health Insurance Fund and the National Health Insurance Fund, especially in terms of operations and limitedness in terms of the levels of health of the hospitals that we have, the level 1, level 2, and level 3, and the level 4, 5, and 6 hospitals in this country. I am also at the same time wondering why the chief structure is already accepting registrations, and the registrations of persons already commenced even before the procurement for the digital registration was done. It's something that is being done in shrouded secrecy. And if you're not careful, it might be the next corruption mad thing in this country. Thank you for watching. That marks the end of our analysis.